Hi, PSMA members. My name is Meg Wall. I'm the Director of Vendor Support here at PSMA, and I'm so excited to be presenting or be introducing our first webinar that we're ever having. We will start these, we'll have these for the next couple weeks on Wednesdays at 11:30, and then we'll start changing the days, but we'll be sure to update you on the actual times that we're having these webinars. So today we are having PDI Healthcare present. We're Debra Hagberg. She is the Director of Clinical Affairs, and she is presenting on, as you can see on your screen, the importance of environmental disinfection in the ambulatory primary care setting. How are you doing today, Debra?
Oh, doing great. Looking forward to doing this program.
Awesome. Well, why don't you go ahead and start then?
Okay, thanks, Meg. Well, welcome everybody, and thank you for attending this first webinar. I'm going to be going over the importance of environmental disinfection in the ambulatory primary care setting. So I have a couple of objectives for this program. First, I'm going to describe the ambulatory care environment and its role in infection transmission, review the critical sources of cross-contamination within the ambulatory care environment, describe the role of practitioners in maintaining a clean and sanitary environment, and lastly, outline some strategies to minimize cross-contamination from the environment. So let's get started talking a little bit about ambulatory care and primary care. So we know that Americans frequently receive care in the ambulatory setting. In fact, over 3/4 of all operations in the United States do occur in an outpatient setting. Chronically ill patients really rely on frequent and intensive use of ambulatory care to maintain or improve their health. So with that, we know that it's critical that care be provided under conditions that are designed to protect the patients by minimizing and eliminating the risk of healthcare-associated infections or other adverse events. And traditionally, compared to inpatient acute care settings, ambulatory cares have traditionally lacked that infrastructure and the resources to support infection control and surveillance activities. When we talk about ambulatory care, it really consists of many different environments. We have your primary care physician offices, you may have community health clinics, infusion and or dialysis centers, which are very frequently seen throughout the network and throughout the communities. We see ambulatory surgery centers. It may consist of a large group practice clinic that includes family practice, pediatrics, medical specialties, and general adult medicine. And we also see a lot of freestanding cancer and oncology centers. And certainly in every neighborhood now, we are seeing some of those urgent care centers popping up. When we talk about infection prevention challenges in ambulatory care, there are several factors that come into play. First of all, when we're talking about ambulatory care, we typically see a large daily volume of patient visits. So there's a lot of traffic going in and out of the facilities. We also typically see a very diverse patient population. In fact, you could have in one clinic senior populations, pediatrics, people that are immune suppressed, women that are pregnant, etc. And oftentimes, this diverse patient population is in the same shared waiting room, as you can see in the picture that's on the slide. Also within the ambulatory setting, there are various environmental surfaces and equipment that need to be cleaned and disinfected. Lastly, we see that there more and more of increased complex procedures are being performed in the outpatient setting. And certainly in ambulatory surgeries, we're seeing even spine surgeries being performed outpatient. And again, as I had mentioned before, there traditionally has been a lack of standardized protocols that really involve infection prevention oversight. We know that there is infection transmission in outpatient settings. There have been numerous outbreak reports that have described the transmission of gram-negative and gram-positive bacteria, mycobacteria such as tuberculosis, viruses, and parasites. Typically, these outbreaks and adverse events associated with breakdowns in some of the basic infection control procedures. So, though these examples are mostly related to serious breaches regarding either medication or injection safety, reprocessing of medical equipment, Basic infection prevention really does start with hand hygiene and environmental disinfection. And of course, today we're not going to go into specifics around hand hygiene, but we are going to talk more specifically about environmental disinfection. So I can't really talk too much about infection prevention unless we cover what we call the chain of infection. And here's a good example that I thought would represent what might happen in an ambulatory care setting. So the chain of infection involves having an organism, a reservoir, a portal of exit, transmission of that organism, a portal of entry, and then into a vulnerable host. So the example I wanted to go over is norovirus, because there are certain periods of time that we see outbreaks of norovirus happening in the community and certainly can impact any kind of healthcare setting. So we're going to start with norovirus as being the organism. And the typical reservoir, as you can see in the picture, is usually in human beings in the GI tract. The portal of exit for that organism to come out from the reservoir is unfortunately through vomiting and diarrhea. And as the person is getting sick, it can be projected out in droplets and really contaminate not only the patient's hands, but also the environmental surface around that patient. Then when you see the picture here of the transmission, and I gave an example of a person touching an elevator button. And this is because oftentimes when someone's sick, they cover their hands and then they might not do adequate hand hygiene or hand washing. So they're able then to transmit that organism by their contaminated hands, as we see here in this example. So these are typical surfaces that may get contaminated. Well, the portal of entry for this organism to complete this chain of infection is again through the GI system. And as you can see, this next individual previously touched that elevator button and then without performing hand hygiene has now inoculated himself with this norovirus. And then as you can see, a vulnerable host, and in this case, norovirus pretty much can affect anybody. And this person now has completed that chain of infection and has become infected with norovirus. So it's important to talk about this chain of infection, because when we talk about infection control or infection prevention, what we want to do is break one of these links from the chain. And to mitigate that risk of cross-contamination and transmission, we focus on areas within this chain of infection where we can most easily break that link. And typically when we're talking about healthcare, what we really look at is looking at the reservoir, and we're looking at the transmission. And those are the easiest things to control versus trying to control the host. Okay? So when I talk about environmental transmission, there are certain factors that really come into play. And these are the factors we try to look at and we try to mitigate to prevent that cross-contamination. We know that many pathogens can survive and remain pathogenic or virulent for prolonged periods of time on environmental surfaces. So there are some organisms that die fairly quickly, but there are many, many pathogens that can survive for long periods of time. We also see that there's constant contamination of the environmental surface. And again, when we think back of ambulatory care and a lot of individuals coming in and out of a facility, those are all opportunities for potential contaminations, particularly through patients' hands from inadequate hand hygiene. We also know that pathogens have the ability to colonize patients, and that actually means that they may live and survive on a patient without even causing them any disease. However, that patient can then be that reservoir for that organism and be able to transmit that particular organism. We know that pathogens have the ability to colonize the hands of healthcare workers. And there's a lot, again, that's a whole other topic about hand hygiene and healthcare, but that definitely is definitely an issue within healthcare facilities. And then we do see the transmission between the contaminated hands of healthcare workers in either contaminated surfaces, contaminating devices, or perhaps even transmission of organisms from the healthcare worker's hands to a patient. Oftentimes, depending on what type of organism we're talking about, it may only require a very small inoculation dose required to cause an infection. In the example I gave previously with norovirus needs very little of an infectious dose to actually cause an infection of somebody that's exposed to it. And then again, we have some particular microorganisms that can be fairly resistant to disinfectants on the environmental surface. And I gave a few examples here. C. difficile, because it forms some spores, can live for long periods of times on an environment. And you actually need a more robust disinfectant to actually kill those C. difficile spores. And norovirus, again, is a hardy virus that can survive for long periods of time. And again, you need a particular type of disinfectant to be able to kill the norovirus. And then most recently, we've been hearing more in the news about Candida auris, which is a yeast. And we're starting to see some outbreaks in healthcare facilities with Candida auris. And again, a little bit more difficult to actually eliminate from the environmental surfaces. One of the biggest areas that you should concentrate on is really going to the CDC website and looking at their guidelines for environmental disinfection. And they have a specific guideline for outpatient settings. So I just wanted to let you know that this is a wonderful resource. If you do not currently have policies and procedures set up, they do have checklists in this resource. They talk about establishing those policies and procedures, etc. So it's really a great guide for you to access as a resource. Within the CDC guidelines, I talked about the checklist, and these are some of the things that really are noted on the checklist. First, you want to make sure that as a facility, you have written policies and procedures for routine cleaning and disinfection of your environmental surfaces, including identifying who within your facility, which personnel are responsible for cleaning. So it may be left up to environmental service or housekeeping staff. It could be the nursing staff. It could be someone within office management. So you want to make sure that you have that identified. Any personnel who clean and disinfect patient care areas, so again, EVS, technicians, nurses, must receive training on those cleaning procedures. So they should receive training upon hire prior to being allowed to perform that environmental cleaning. And then at least annually, there should be refresher training, and anytime new equipment or new protocols have been introduced into your practice. And then lastly, I do want to note that if you do have environmental cleaning that's performed by contract personnel, you should verify that this education is being performed by that contracting company. Part of the checklist is choosing the right disinfectant. So you want to ensure that you select an EPA registered disinfectant or a detergent disinfectant with label claims for use in healthcare. So very important that these products undergo stringent testing and efficacy testing so you can be assured that you're getting a product that works. And then again, you must follow those manufacturers' recommendations for use of those cleaner disinfectants. So you want to make sure you're following the appropriate contact time, the dilution time if you need to dilute it, how to use it, etc. And disinfectants that are considered ready to use or dispensed in pre-measured amounts are preferred over those that require mixing. And that's probably fairly obvious, but anytime you have to do more steps to mix or dilute a disinfectant, you're always introducing a potential risk of error. So I want to go through just a little bit on cleaning and disinfection in the patient areas. And this picture depicts a typical exam room. So you'll see the exam table, a desk, chair, scales, etc., the sink, the cabinets, and a few pieces of medical equipment. So we talk about, and CDC talks about high-touch surfaces, and these are surfaces such as the floor and doorknobs, desktops, etc., that are frequently touched by a lot of different hands throughout the day. And under environmental surfaces, there comes 3 different categories, and again, this is defined by CDC. There are pieces of equipment that are considered non-critical patient care items, and those are items that contact intact skin, such as a blood pressure cuff, a scale, or any other type of reusable equipment that comes into contact with intact skin. Then the second category is considered semi-critical patient care items. And these are items that contact mucous membranes. So an example would be a thermometer or a tonometer, a nasal probe, any reusable vaginal devices or probes. So those are considered semi-critical. And then lastly, we have the critical patient care items. And these are items that are going to be entering either sterile tissue or the vascular system. And these items must be sterilized. So examples are your IV catheters, your biopsy instruments, urinary catheters, etc. So they're going into sterile cavity or sterile tissue. There are other areas you may not think about. So we talked about the patient areas, but typically what we see in ambulatory care are your common waiting areas. So an example are the waiting rooms or even the play areas if you're in a pediatric type situation. And these high touch surfaces, again, would be considered like your doorknobs, your desktops, but even sinks, phones, chairs, the playscapes, toys, etc. So these are all things too that do need frequent cleaning and disinfection. We do see in ambulatory settings that there's shared treatment areas. So this is an example of, you see the different bays with infusion chairs. So this is a typical setup for whether it's dialysis, it may be a chemotherapy infusion center. But so this, again, there's close proximity between patients, and you'll start seeing that there can be a lot of cross-contamination from patient to patient or just throughout the different types of equipment that are used on the individual patients. And lastly, we also see special procedure rooms in ambulatory care. And these are basically not your typical OR, but they're serving as an outpatient OR type setting where procedures are being done. So again, you'll find that you'll have non-critical patient care items, semi-critical patient care items, and also critical patient care items that are used in special procedure rooms. One of the things that we're seeing a lot of now in healthcare is the increase in healthcare technology and touch screens. So the reason I bring this up is that typically the touch screen technology usually cannot use some of the more standard disinfectants. So you have to make sure that when you are dealing with equipment with touch screens that you do read the manufacturer's instructions for use as to what types of chemicals can be used on the actual touch screen itself. A lot of times it's simply just plain 70% isopropyl alcohol, and that you cannot use bleach or quaternary ammonia type disinfectants on the touch screen. So, but you'll see this frequently used within healthcare, even in OR settings, people using their smartphones, their iPad technologies, and even just touchscreen monitors. So we're seeing more of this being used in not only ambulatory care setting, but also in long-term care and acute care settings. So as far as infection prevention measures, the things that we recommend is following the Centers for Disease Control and Prevention, the frequent cleaning and disinfection of all those high-touch surfaces and devices, looking at the frequent use of surface cleaning and disinfection along with hand hygiene by healthcare workers, by patients, and by visitors. So this promotes an environment of safety and mitigates that risk of infection transmission. And again, more frequently, we're seeing studies found that using even something as simple as an alcohol wipe can help remove organisms such as methicillin-resistant Staph aureus that can contaminate these surfaces. So it comes down to what's your role in infection prevention. Well, of course, everybody should be practicing hand hygiene as indicated by CDC and the World Health Organization. Everyone should be invested in cleaning and disinfecting medical equipment that's used between patients, and that really is a role for everyone to take part in. We want to make sure that you clean and disinfect all equipment or surfaces that certainly are visibly soiled and on a regular schedule according to your protocols. So protocols do need to be set up for each individual practice. You want to clean and disinfect frequently touched surfaces, and just keep in mind that chain of infection, and remember that norovirus example that I went through. And always use hospital-approved environmental disinfectants in accordance with the specific manufacturer's label. So when we talk about disinfectants, there are several different types of chemicals that are used in EPA-registered disinfectants. So you do want to make sure that you're following the manufacturer's label to use it correctly. And remember to clean your screen since the increased use of the touchscreen technology. Some of these important strategies to help mitigate is develop your policies and procedures. Also develop measures to monitor and look at that CDC checklist. So do some observation, some surveillance of infections or outbreaks that may occur, collect that data, analyze the data, and be able to present findings and provide feedback to the staff within your facilities. And then, of course, always celebrate success when you see people doing things correctly. I want to transition a little bit into who is PDI, seeing that you may not be familiar with us. But PDI is an infection prevention company. It is privately family owned. We are driven by a higher purpose to lead the fight against preventable infections and ultimately help save lives within all healthcare institutions. We have different divisions. We have the PDI Healthcare Division, Sandy Professional, which is a food safety division, and we also do some contract manufacturing. I want to go over that we have a history of innovation, and you may not know, but we were the inventors of the first alcohol prep pad, which I think is pretty cool, in 1963. And in 1977, the PDI Healthcare Division was established. And also PDI invented the first surface disinfectant germicidal disposable wipe in 1988. So you may be familiar with using disinfectant wipes, but really came on the scene in 1988 with the first Sandy cloth product. And as you can see, we have a history of innovation throughout the years. Last year, we introduced a Sandy cloth prime wipe. We launched our Profen nasal decolonization kit to help prevent surgical site infections. And we introduced an insight app that our team uses to help identify opportunities to optimize infection prevention protocols for our customers. And this year, you will see in the near future a few new products being launched for 2019. I just want to let you know that we service the whole continuum of care. And certainly from our ambulatory partners, physician clinics, ambulatory centers, dental offices, community health centers, into the acute care arena with hospitals and long-term acute care hospitals, and then post-acute as well with rehab centers, long-term care, assisted living, hospice, and home care. So our products can be used throughout the whole continuum of care. And we have our leading product brands. You may be familiar with our environment of care products with Super Sandy Cloth, the purple top as people call it, is the #1 brand disinfectant in healthcare. But we have various surface disinfectant products. We have our patient care products with the #1 hand wipe in healthcare being our PDI Sandy hand products. And then our interventional care line, which also used in healthcare, from our Profen nasal decolonization kit to our Prevantix line of CHG and alcohol for skin antisepsis and for vascular access disinfection. Not only do we have great products, but we have great solutions for you as well. We know that the products themselves, the chemicals, can kill those microorganisms, but it really does take people to prevent infections. So to help support the people and our customers, we help with product protocol establishment, and we have different applications such as our Insight app, but also different types of SaniTag products to help identify what products can be used on what types of devices. We have point of care accessories such as our brackets and floor stands. And we also provide a lot of staff education. So we have instruction for use charts and other types of educational brochures. And here's just a sampling of our environment of care disinfectant portfolio. We have different products with different contact times. We have alcohol-free products. We have 1 to 10 bleach solutions that are sporicidal products. Our Sandy Cloth Prime was launched last year with a 1-minute contact time, and our Easy Screen product that is our 70% isopropyl alcohol for those touch screens. So we really can encompass all of your needs, and it comes in different formats. So large wipes, extra large wipes, and large environmental service pail formats as well. This is the Easy Screen Cleaning Wipe for the touch screens. And again, we have different types of solutions to help you promote the use of cleaning your screens. And I want to finish off that on the PDI website, we do have free CEs at pdihc.com where you can track your own account, enter your own account, and then track your own free education as well on different infection prevention topics. And lastly, we do work with PSMA as a powerful partner in infection prevention, and you can access our products through our distributor partner at McKesson. In summary, I want to conclude that Americans frequently receive care in ambulatory settings. It's critical that this care be provided under conditions that are designed to protect the patients. We do know that outbreaks and adverse events are associated with breakdowns in basic infection control procedures. So we want to focus on environmental cleaning and disinfection. We want to make sure that people are cleaning their screens with the increase in technology, develop policies and procedures to fit your facility, and then certainly monitor compliance to those policies and procedures. And lastly, partner with PDI for all of your infection prevention needs. And I'm going to end right there.
Awesome. Thank you so much, Debbie. I would like to open this time up for some questions if you want to put something in the chat window. Until then, I actually have a couple questions for you, Debbie, if you don't mind answering those.
Absolutely.
Okay, so the first one is, what is considered contact time for disinfectant?
Oh, okay, that's a great question. So contact time is the amount of time that the disinfectant, the chemical, needs to be in contact with the surface that you're trying to clean and disinfect for it to meet, to kill the organisms that are listed in the kill claims for that particular product. So a product may have a contact time of 2 minutes. So when you wipe down that surface, you want to ensure that that chemical is in contact with that surface for the 2 minutes. So that's the testing that has the information, the efficacy testing has been supplied to EPA, and that's how it's registered under the EPA conditions. So different types of chemicals may have different amount of contact time. You may have a chemical that is maybe just a plain quaternary ammonia, which may have a longer contact time of 10 minutes, versus a product that might be a quaternary ammonia plus alcohol, usually has a much quicker contact time.
Okay, awesome. Thank you. So the second question is, all right, let's say a practice has a contracted cleaning service that comes in after hours every day, but how important is it to disinfect during the day?
Yeah, great question. I am aware that oftentimes in ambulatory care settings, they do have contracted services, which is great. And of course, much easier to clean once it's at the end of the day when the staff are gone and patients have left the building. So much easier for them to do a real good, robust cleaning. However, it's really important for individual practices to have products available to do some frequent cleaning in between. So you think about the amount of patients that are coming into an ambulatory care practice, the volume is quite high. And you do want to make sure that people are identified within the practice to, if they're doing the turnover of the room in between patients, that they have a product that they can usually pull a wipe, do a quick wipe down of anything that may be shared, like the exam table in between patients, any equipment such as your blood pressure cuffs, any of those surfaces, a quick wipe down in between, so that you're really mitigating the risk of infectious organisms being on those surfaces and being able to be transmitted to the next individual coming into the room. So it is important to have a product readily accessible for the clinic staff to utilize and wipe down in between patients.
Definitely. Okay. And then lastly, do the products have to be EPA registered?
Yeah. Oh, great question. Yes, basically the products in healthcare should be EPA registered, and you want to make sure that there is a difference between products that consumers buy in their local chain store. And those are good products. Those are, good products to be used in the consumer setting. But there are specific requirements that EPA requires for healthcare settings. We really want to make sure that we are using the appropriate types of products to be able to kill the organisms that cause healthcare-associated infections. So they do need to be EPA registered, and it's very strict. It's a prescriptive methodology for these products to get tested in order for them to be EPA registered. And anyone can go onto the EPA website and find out which specific products do have that EPA registration. So it is open to the public.
Perfect. Okay. Lastly, we had one question from one of our participants asking how our members are able to buy PDI wipes. Actually, if you don't mind, I'll answer this question.
Sure.
So for our members, the best way to access PSMA pricing will be through contacting your local McKesson rep and telling them that you want to buy the PSMA PDI wipes at that discount. So I also want to point out that PDI recently became our preferred vendor for infection control. So specifically talking about about the disinfectant wipes. And so they're actually allowing us to offer our members tier 4 pricing, which is essentially one of the best prices you're able to access out on the market right now. So, and that's exclusively for PSMA members. So if you let your McKesson rep know that, you're able to access that discount. And if you also, I want to point out that at www.psmaconnect.com, we have a lot of our other discounts that we offer to our members that we would love for you guys to go and check out. Do you have anything to say on that, Deborah?
No, I appreciate the opportunity to talk to your members today. And if they have any specific questions, I certainly, can be contacted. And, I'm sure, Meg, that you can send out my contact information to any of the members that are looking to get some additional information. And we obviously work very closely with McKesson, so they can certainly ask questions through their McKesson reps, and McKesson will reach out to PDI if it's something that they're unsure of how to answer. So we're here as a resource, and we really want to support your members as best as we can.
Awesome, thank you. I also wanted to throw out that if you came in late and you didn't get to see the whole webinar, we're actually going to have the webinar up in our website in a video library portion in just a couple of weeks, so hang tight if you didn't get to watch the whole thing. Thank you so much, Debbie, for your time. This information was very helpful for our members, so we are very thankful for that. Have a great day.
You're welcome. Thanks, Meg. Bye-bye.